for me? Close your eyes. What toe am I touching? Good. Alright, so on this quick video right here, I wanted to show you how you can make an improvised splint. We'll say it's for the leg, for the femur bone here, with the bare essentials, meaning all you have around you and on you. So we'll say that we needed a splint. I walked around, I found these two sticks. I tested them, made sure they weren't brittle, hollow, they weren't going to break. Cut off any sharp edges so it's not going to poke into the leg here. So a knife, I just took a rock and just kind of sawed down the sharp points here. If whatever that you can't take off, little shards and sharp points, use tape, wrap some cloth, just put little pieces of cloth on the stick, so when it presses up against the leg after you tighten it, it's not going to poke the person. So what you want to do is, I got one here and one on the inside, a little bit longer than the joint. So if this is the foot, it's going to come out a little bit longer, goes up past the hip, same thing on the inside, up to the groin area. So this one cuts off right about here. All I had on me was my wraps and gauzes. So 3, if you can, is what you want to use. So we'll say the knee joint is right here, above and below the joint, the knee joint. So I used the most secure ones I had. One right here, one right here. And let's say I was wearing a long sleeve shirt or had another shirt. I just took the shirt off and secured it here. So you got 2 pretty decent strong sticks here, both sides of the leg. It's braced really well, tightened, and you know, obviously if you have good solid equipment like a Sam splint, for example, use that first. But I didn't have anything on me, so I just went and got these 2 sticks. And this is a pretty good splint. I've tested it. It doesn't really move. We could, you know, get say you had a blanket or a rug, put under, tie it again. You can move the person, put them on a stretcher, wait for help. But this is just the bare bones, what you have on you to use. Splinted really nice, have 3 wraps, and after that, you would want to check the CMS, see if they can wiggle their toes, talk to them, pain management, ask them to close their eyes. Say you get the middle toe, pinch it, ask them, what toe am I touching? Look for signs that it's not damaged too much. And this is the basics. Above the knee joint, wrap it. You're going to lay all your materials out first, put the sticks on top of it. Above the knee joint, wrap it. Below the knee joint, wrap it. And one at the bottom. You got one running down the inside of the leg, and then this one here, from hip to past the foot. And stay with the patient if you have to, and that's the basics. Got a little splint here. So, improvised splint.